Dear colleagues, my name is Pascale Allotey. I've been the director of the WHO Department of Sexual and Reproductive Health and Research since July 2020. It's been a pretty intensive 15 months with still so much to learn. The department includes HRP, which is the UNDP, UNFPA, World Bank, UNICEF, and WHO program on research development and research training in human reproduction. Over the last 50 years, working with many of you, HRP has supported the generation of evidence across the life course. Our work spans contraception, infertility, STIs, reproductive cancers, comprehensive abortion care, and perinatal health. We have also integrated gender and human rights to operationalize the critical interventions and outcomes to address the fundamental issues of power and injustice in harmful traditional practices including FGM, child marriage, disrespectful maternity care, gender-based violence, and sexual violence, including in humanitarian settings. The SRH department draws on the research and global expertise of HRP to set norms and standards and to provide technical support. As HRP and WHO, we engage with governments and ministries of health to strengthen health systems towards ensuring the highest attainable level of sexual and reproductive health for all. It's a big agenda with a big, impressive team of whom I am immensely proud. The team sits in the WHO Division on Universal Health Coverage across the life course, which includes other departments, including maternal, newborn, adolescent health and aging, directed by my colleague Anshu Banerjee, who will address you shortly. We collaborate with departments of nutrition, NCDs, mental health, HIV, and health emergencies. Our research agenda sits in the WHO Division of Science, where we can also tap into the expertise on digital health and innovations, data analytics, and the impacts of tropical diseases on pregnancy, amongst other things. All this is to say that technically, we have a pretty remarkable structure to deliver on our mandate for sexual and reproductive health and research. But we need to acknowledge more explicitly that this work is not done solely in WHO. We rely very much on your expertise to inform the prioritization of agendas, establish the policy relevance, engage in the co-production of the necessary evidence, and disseminate guidelines and various other products that support the ongoing professional development and practice of obstetrics and gynecology. Dear colleagues, the field of sexual and reproductive health is in a precarious state. We are off target to meet all our relevant SDGs everywhere. Time and again, over the last 15 months, I have heard an important message from civil society organizations, from colleagues in our regional and country offices, from practitioners, that we are fragmenting women's bodies and lives, not just into different body parts, but also to the various functions of the same body parts. As people dedicated to sexual and reproductive health, we must seize the opportunity to create and deliver a health system and practice that values a comprehensive life course approach. We cannot, for instance, address contraception, abortion, and complications of pregnancy as unrelated if we want to provide truly women-centered care. Biomedical and clinical interventions will always remain important to practice, but we still have an important obligation to ensure that we treat the whole person in their context. This is not a politically easy message, particularly in the current geopolitical climate. But if we thought it was easy, then we are in the wrong profession. Together, WHO and FIGO form a large community of dedicated professionals with many valued partners and stakeholders, all working towards the same goals: the highest attainable level of sexual and reproductive health for all, and a world with gender equality where bodily autonomy is respected and protected, and where access to high-quality, affordable sexual and reproductive health and rights services for all is a reality. I wish I could be there with you in person. Nonetheless, I would like to convey my sincere commitment and desire to strengthen the relationship and collaboration with FIGO. We have many colleagues there with you in Paris, an explicit demonstration of FIGO's value to WHO and to the field. Please take the time to engage with the WHO stream of sessions and visit our experts at our dedicated WHO space to explore opportunities to realize our collective vision. Thank you.